My name is Sean Clark. I'm a professor of nursing at McGill University. For the past 15 years, I've been involved in research on nurse staffing in hospitals. The registered nurses are educated in a broad variety of aspects of illnesses and their treatment. They watch over patients to make sure that complications are picked up at the earliest signs possible, and then they act to reverse those problems.
We know that a higher registered nurse mix in comparison to non-registered nurses actually produces better outcomes for patients. For example, you've got someone who's spiraling down. They're coming close to perhaps having a heart attack or a stroke or something, and there are symptoms that are accessible, but they are missed because no one is there with the skills to actually understand what's being seen. So that would be considered a failure to rescue.
The consequences for a failure to rescue situation for the patient are fairly clear. In the worst case scenario, the patient dies. For the healthcare system, the more work we have to do to rescue the patient in the end, the higher the costs for the healthcare system. In general, registered nurses prevent complications from happening in the first place.
Some of the research where people have actually looked at, and one of the factors being failure to rescue, they have found that with the appropriate registered nurse staffing, for instance, that they can actually detect some of these conditions very early and then have the interventions, have the team players who need to intervene to reduce the further snowballing of some of these effects.
There have been Canadian studies that show that the proper staff mix and the proper registered nurse staffing will reduce the 30-day mortality rate for patients significantly.
It's consistent with the trend that researchers in other provinces and in other countries have found.
It's not just simply a matter of being there. It's surveillance, it's being there, but knowing what to look for and knowing when to act on what you see. That's key to the registered nurse role. If we attend to proper nurse staffing, our patient outcomes will improve.
Research shows that better registered nurse staffing can improve patient outcomes and reduce healthcare costs.